I'm going to be talking about the MANIFEST study, which is a phase 2 study of CPI-0610, a pan-BET inhibitor for patients with myelofibrosis that are intermediate to or high risk, that have failed ruxolitinib previously, and they get monotherapy CPI, 2 weeks on, 1 week off. It's an oral drug, or in combination for patients who are having a suboptimal response to ruxolitinib. Those are the cohorts 1 and 2. They're stratified by whether the patients are transfusion dependent or independent. The primary endpoints of the study depend on the cohort the patients are in. For transfusion-dependent patients, it's conversion to transfusion independence. And for patients who are not transfusion-dependent, it's spleen volume reduction of 35% or more after 6 months of therapy. There's also a cohort 3 that will be presented at the meeting, which is treatment-naive patients who get combination therapy up front. The major point of the study is that BET inhibition has rationale that's preclinically defined in studies that converges on the NF-kappa B pathway. And this has been shown in MPL-mutated murine mice, that the combination of a BET inhibitor with a JAK inhibitor works synergistically together in reducing spleens, improving counts, and improving survival of mice. So we took this into the clinic, and what you'll see from the presentation is that the combination of the two drugs work probably the best, with a 25% spleen volume reduction rate and a 50% at 6-month total symptom score improvement, and 6 out of the 14 patients who were evaluable for an anemia response had gained transfusion independence. And about half the patients had at least a 1.5 gram per deciliter increase in hemoglobin in those patients who were not transfusion dependent. So we saw activity that was quite impressive in a patient population that was advanced, a lot of anemia, high molecular risk mutations, and expectation to do poorly. And this has stimulated the expansion of the study and considerations for a phase 3 study.